So, if you come across this video, it's really specific, or it's intended for a real specific amount of people, which I know is a small amount of people. So it's anyone that's had a thing called Thunderclap Trauma, Thunderclap Headache, Thunderclap, whatever. Basically, I went through this last year and I really struggled to find, whilst I was waiting to see doctors, like any blogs or anyone that's basically not had what's considered like a thunderclap trauma that's not resulted in a bleed on the brain or a hemorrhage, whatever you want to call it. Which didn't happen to me, and I really struggled to sort of find that information out, and it was sort of a lot of months went by. So I just thought I'm going to do a video. It's just going to be me talking to you and explain what I went through, in the hope that if anyone goes through a similar thing and they come across it, I might be able to give you a little bit of peace of mind. I'll start with the story. So basically the reason I'm doing it now is quite simply, it's coming up to like the time it happened last year. So it was the Monday, the 11th of March last year, 2019. I had, funny enough, I'd just had 3 months off work on paternity, which is fantastic. Got time to spend with my little girl. She was obviously only like 3, 4, 5 months old, and it was amazing. And then I went back to work for a week. And then on the Monday the following week, I got up to go to work, everything was fine. I was nipping back upstairs actually to say goodbye, like last sort of goodbyes, quick kiss to my wife and girl, and then I was going to head off to work. And as I walked up the stairs, I basically thought someone had smacked me over the head with a hammer from behind, and then carried on doing it all the time. Now, in the immediate aftermath when this happened, I didn't actually remember any of the sort of the next 2 days. However, over like the course of 6 months, things started to come back to me. Now, unfortunately, I do remember it. I wish I didn't, but I do. So, felt like I couldn't breathe, presumably probably having like a panic attack to go with it, and it just felt that way. It just felt like someone was stamping on my head or had laid me down on the floor and just constantly battering my head with a hammer. Suffice to say, without going into all the dramas, I was rushed to hospital and put in A&E. I vaguely remember, or specifically remember, sorry, obviously my wife and girl there and the ambulance crew dropping me off. I remember the ambulance crew, I remember the face of the ambulance crew as they left, which, suffice to say, wasn't, I'm trying to think of the way to explain this, and it's not their fault, but long story short, I saw their reaction and thought, holy hell, I'm in trouble here. And I just remember, I remember 2 things. I remember across the way from me there was 2 security guards holding down a drug addict who was having an overdose, but wanted to beat up all the staff. And then I also remember sat in my bed, basically trying to bite the rails, metal rails, because I was in so much pain. And then eventually they sent me through for a CT scan, and it didn't look good, can't lie. Usually when something like this happens, I think it's quite common that you're actually having a bleed on the brain or a hemorrhage. So yeah, I don't want to go into like dramatise it, but it's obviously having an effect on me because, you know, it just didn't look good. And at one point, I sort of, as I wheeled off, I remember sort of saying goodbye to my wife and my girl. It was that bad, and yeah, obviously that's not a nice thing to do, and it was quite traumatic. But I went for the scan, and they could see that there was no bleed. They did find something, which will come on to later, it's specific to me, but they didn't see a bleed, so that was good. So yeah, that's it. I went upstairs, I had morphine, it calmed down, it stopped, and I was released later that day pending like further investigation. The immediate aftermath, I forgot all that, and then the next sort of maybe month, I basically had a migraine for like a month. Every time I did anything strenuous, it would come back as really, really painful, so I was advised to obviously rest. And then gradually as the weeks went on, maybe 2-3 weeks in, I started to have like an hour maybe where, oh God, I feel alright. And then 2 hours, and then 3 hours. And basically by around the 5-6 weeks mark, I didn't really have a headache, I just didn't feel great, and we were good to go. I'd not really seen any doctors, did not really explain what they thought had happened, maybe an infection or something, and they basically just discharged me. It turned out that the thing they'd seen on my brain was actually from basically when I was younger, when I was born, I had a very, very, very mild stroke when I was born, very mild. And that's what they saw, they saw the dead cells around that. So that's what sort of scared them, and that's what caused the whole issues. But yeah, but that's okay, that's fine. So, go home. Now this is where I'm hoping I could help people. At that point, you discharge your GP, and, you know, bless the GPs, they're not specialists in neurology. They were just treating the symptoms. So it was at that stage, after 6 weeks, I suddenly realised that I was struggling to do a lot of things. And one of the main things was, for me, sort of logging on to Photoshop, for example. I forgot everything. I didn't know how to log on. I forgot where it was, Lightroom. I basically lost all those sort of like memories that I would consider, not memories that you have like daily, so obviously I remember my wife and all that stuff and your instincts, but like memories that maybe every now and again you have to sort of like do, and as you're doing them they start coming back to you. So like if I'm going to do a layers or a masking in Photoshop, stuff that I won't be doing daily, but every now and again I do and it kicks on. And it was obviously quite, it was pretty scary, to be honest. So I went to my GP. They did a 5-month wait list for the specialist I needed to see. So luckily I'm in a position that we could dip into savings, and I paid for a consultation to be private. So yeah, I went to see the doctor, and that was like a massive relief really. So this was like a specialist who dealt with or deals with people with head injuries, 25 years experience. And basically the thing in England, if you watch this in the States, is we obviously have a fantastic health service, the NHS, which is amazing, and the people that work there are amazing, but it is hugely underfunded and has been neglected for many years. And because of that, you have a situation where you're in like urgent care, and these situations happen where if you want to then see a specialist, it's a long time to wait. And like I said, luckily I'm in a position that I could afford to go private, and I basically saw the head of, I think it was Leeds or York, I can't remember, of neurology, because obviously the Moonlight is private. And yeah, he put my mind at rest really. He'd been dealing with people, I think he'd had around 100 patients have Thunderclap in his sort of 25 years experience. He said one person had it again, no one else did. And he just talked me through it. He said, look, your memory's going to come back, you've got to, and he explained it. So I'll explain to you how he explained it to me. He said, basically, you have blood vessels in your brain, obviously, but the differences within your brain, they have nerves, and he said, you've had an infection. He said, there's no point in us looking into what infection, because of the reasons I just mentioned, that it's not normally a common thing and it doesn't come back because of one thing, so what's the point of finding what the infection was? But he said it's made your blood vessels basically go like this, contract, or push loads of blood in, not lots of blood, but as the veins have been doing that, it's caused serious problems with the pain. Now, the reason for the memory loss and the sort of whole sort of, me struggling to really like gather my thoughts is one thing I said around like holding more than 3 or 4 tasks in one go was impossible at this point after like 2 months or 2.5 months. He said it's because your blood flows basically, maybe this was just simply really layman's terms, and there might be professional that watch this and be like, you're completely wrong, but he basically said your blood flow's not correct and we're going to put you on this medication, propranolol, which I think people use for like anxiety and all that stuff. And he said it's lowers the blood pressure, regulates the blood. So I did that, and yeah, it didn't really work. It did work at first, maybe it helped with the anxiety. As soon as I knew that I was going to get my memory back, he said, look, it's just, you're going to have to work on it. He said, you might lose some things, but just keep working on things, and I'm sure you'll be back to normal type scenario. I said, although I think some people have lost the ability to do certain things. So obviously that worried me. But the main thing was I knew like I was going to be all right and I could work through it. I went home and I spent about another 3 months off work. I gradually got better, I guess is the word to say if you're out there and you've had something similar and you're in that zone now of not being able to read a book like I did, forgetting the alphabet like I did. If you're in that zone now, I promise you, I went on to propranolol and bit by bit, week by week, things just got better. I went for a walk every day, and again, just from the start of this, we'd go for a walk every day. It was around springtime, so the weather was quite nice with from a little girl, and it'd start from, for every walk I had, maybe every 2 days, I'd come home and crash for an hour. I'd just be exhausted, to after 2 or 3 weeks, maybe once a week, I'd just have a blip and I'd come home and I'd be asleep. Physical side, from memory, I went from not being able to honestly read a page of a book to not being able to like do my Photoshop stuff to just suddenly starting to practice. And I had to watch a lot of YouTube. I had to basically relearn a lot of Photoshop. But then about around July time, so March, April, May, June, July, 4 months after it happened, I was learning a layer process. I think it was a video by Sean Tucker on sort of how you layer up photos. If you're into photography, you'll get this. If you're not, sorry. But yeah, basically, I was learning something that I thought I'd have to learn new, and I couldn't remember me knowing it before. And so it just clicked like that. It was really amazing. And I suddenly was watching this video halfway through, and it basically was a process I used to do. And I was like, and I remembered it. It was really, it was really amazing. So yeah, so I stopped the video, did it myself, went back to the video, and used it as a little bit of like a test. and it was absolutely brilliant. And I realised then that it is working, it just took so much time. So I was studying at the time. My work decided, in fairness to them, to give me a piece of study to do for like some work I was doing, rather than to come into work and try and do like loads of tasks, because my job's quite busy and people throwing things at me, and that wasn't happening. And that helped. And yeah, and that's it really. I think what I wanted to say was, it took a long time, and I can't lie, every time I got to about October time and I went back to work, I really struggled for about a month. I just couldn't, it was really hard. I couldn't hold like tasks. That's the only thing I could say is, few people asked me 3-4 things. Unless I wrote it down, I just couldn't answer them. It really was just like my brain was being overwhelmed. It was like not happening. So yeah, I just kept going, but then it got to like November and I felt I was more or less better. And it wasn't until around Christmas time where suddenly something really did hit me and I felt like back to normal. I'd stopped having to write lists at work or have like a plan every week with what I needed to do, which by the way is not me at all. Like, I do have dyslexia and I have since a kid, but really mild dyslexia. I've never had to mention it before, but basically in this time I was mentioning it a lot because it was all like similar symptoms, where I'd always been this person that will get things done, but get them done my own way, and usually I'll have like a broad spectrum of a list, like a project plan, for example, if I'm working on a project. But the day-to-day stuff I wouldn't. I'm not that type of person. But I had to for months and months, which in itself is hard work if it's not your instinct to do so. And then yeah, Christmas happened and boom, I just came out of the tunnel or whatever, out of the dark, and I suddenly was absolutely, as I am now, feel back to myself. No lists anymore. I'm doing everything that I can. And it was like I came out of, of a dark place. And now when I look back, I am proud of myself for getting through that, but I suddenly realised throughout the whole process, until I saw a specialist for like half an hour, I couldn't find this, because every time you Google Thunderclap, it comes up with a bleed on the brain and serious stuff like life-changing. That did not happen to me, and what I found when I was Googling it is obviously it seems like they're quite different in terms of symptoms. Quite similar in symptoms in some ways, but obviously for someone like me it's going to be a lot less severe and a lot less life-changing than unfortunately someone who is unlucky enough to have a hemorrhage. And it's for those people out there that have had a thunderclap trauma and they're losing their memory and they're really struggling and you can't find any help. I wanted to just tell you about my experience. So I don't want to dramatise it anymore. I am better. It has taken time. Things like reading every day has massively helped. Listening to music has helped hugely. Listening to, well, no, I didn't listen to audiobook. That's a lie. I've just recently started listening to audiobooks. But basically practicing on your concentration and not going back to work too soon. Work probably stepped me back a little bit, not from their fault, but by pushing myself to go back and having a week of, I basically went back for 2 days, worked for 1 day and had to have 3 days off because I slept for like 20 something hours. I think because of all the sensory stuff that I went back to work for. So just don't be too hard on yourself. If you've found this video and you're having the same as me, then just do baby steps and remember there's people out there that have been through it as well. Throw a comment in, message me, whatever. I'll happily help people that's going through this as well. I really understand how hard it is, and just stick with it. Little baby steps and really practice that memory and you'll honestly come back. And the last thing I will say is, when you say to yourself, I feel like I'm better, you're not fully better. You will genuinely know. It was like a full on, oh my god, it was 2 weeks in, I was like, this is brilliant, I'm actually properly better. Whereas the October, November, December bit, I was saying to myself, I think I'm better, but I wasn't. So that's it really. So there we go, that's my video. I hope it has helped, and yeah, just throw some comments in if you're going through it and you found this video and you need any help or want to talk. So yeah, thanks a lot, and yeah, see you soon.